Hello, my name is Nancy. The topic is a suPAR biomarker for chronic kidney disease. In definition, is chronic kidney disease is defined as a decrease in the glomerular filtration rate below 60 milliliters per million per 1.63 M2 and kidney remain for 3 months or more.
I remember the week after the first diagnosis, sitting at the edge of the bed of this hospital and just thinking, what am I doing here? What am I doing sitting there? Why am I wearing this gown? Why have I got plastic bands around my wrists with my name on? And I remember the nurse coming to speak to me, and I just absolutely just broke down and lost it. It just felt like the rug had been pulled away from me. I was supposed to go into work that day. I wasn't going to work. I wasn't doing anything normal that I normally do. Very tired, and all of a sudden you can get very sleepy. Also, you get a bit of memory loss, which doesn't help. You can start losing focus and concentration, and then you get some fluid retention, which blow out your ankles and legs. So you've got to watch your fluid intake. It's very difficult to be told you can't drink that amount of fluid that day. It's very difficult to be told you can't eat certain things like spinach, tomatoes, nuts, and cheese for high potassium. It really sort of feels like all your best things have been robbed away from you. It's managing all the drug regime that you've got to take as well. Also, you've got to balance out all the dialysis deliveries that come into your house. You've got to do stock take of dialysis deliveries. You've got to be there to accept the dialysis deliveries. So there's all these sort of things you've got to balance. It's a fine balancing act. It really is. I think better care in CKD is crucial long term. I think it's a disease that's been neglected, it's been overlooked, it's not been really focused on, but it is called the silent killer for a reason. I want people to feel better. Obviously, no one wants anyone to feel as sick as it can make you. It's got to be easier to manage as well. There's a minefield of issues that renal patients have got to face on a day-to-day basis. And I think anything that could alleviate their issues and make their day a better day would be absolutely fantastic.
In application in medicine, the Dr. Mosquera, head of the nephrology department of the Luis Bernaza Hospital, revealed that the rise of developing chronic kidney disease in the female population, according to same study, has an average prevalence of 14% in women and 12% in men.
Every day is a new chance to live your best life, and staying healthy is a huge part of that. Listening to your body can make a big difference in maintaining your kidney health. Because chronic kidney disease, or CKD, develops slowly, it's important to know if you're at risk and understand the symptoms. 1 in 3 Americans is at risk for chronic kidney disease, and roughly 90% of those who have CKD don't even know it. There are 4 risk factors to be aware of. See if any of these apply to you. Has anyone in your family ever had kidney problems? Are you of African American, Hispanic, or Native American descent? Do you often use over-the-counter pain medicine or any recreational drugs? Do you have diabetes, high blood pressure, or heart disease? If you answered yes to any of these 4 risk factors, talk to your doctor. Testing for CKD is as simple as a blood and urine test. Whether or not you have risk factors, it's a good idea to watch out for these 7 symptoms. Everyone experiences symptoms differently, so if you have any reason for concern, talk with your doctor. When kidneys aren't working right, your body holds on to fluids. You can tell by checking if there's swelling in your hands and feet and/or puffiness around your eyes in the mornings. If fluid isn't filtered well, it can also build up in your lungs and cause shortness of breath, even when you do something that requires very little effort. Too much waste in your blood could also change your hunger level. You may not feel like eating, and your loss of appetite may come with nausea or vomiting, which could lead to weight loss. How about a change in bathroom habits, like getting up more at night? Pay attention if you're urinating more or less than usual, your urine is bubbly or foamy, darker or paler, or if it has blood in it. Kidney problems also cause toxins to build up that can cause severe itching. You might feel so itchy that scratching doesn't help. Have you felt tired lately? If you're low on energy in a way you can't explain, check it out. The tiredness may come with feeling cold or trouble concentrating. People with CKD may also develop pain in their lower back that gets worse or doesn't change with moving or stretching. Knowing your risks and what to watch for is a start, but symptoms can vary since everyone experiences them differently. Remember, there could be other reasons for any of these symptoms on their own. If you have symptoms or risk factors, talk to your doctor. Getting the right help early can make a big difference in managing kidney disease. So take action over your kidney health today. Learn more at FreseniusKidneyCare.com.
And pros and cons. In the pros, evidence suggests that Cysteine C, in addition to being an useful biomarker for estimating renal function, may be the method of choice among a wide range of clinical situations, ranging from GFR surveillance in diabetes to evolution of renal function, acute kidney injury in critically ill patients, and count in patients at high risk for chronic kidney disease and involvement and creatinine ratio greater than 30 mg per gram is a risk factor for chronic kidney disease. Cardiovascular disease are the main cause of morbidity and mortality in patients with chronic kidney disease.
Chronic kidney disease, CKD, is a gradual loss of renal function, typically developing over the course of months or years. Many conditions, both within and outside the kidneys, can cause progressive damage to the kidneys over time, leading to CKD. Of these, most common are diabetes and hypertension, both of which directly damage blood vessels within the kidney, destroying renal tissue. An acute kidney injury, if not completely resolved, may also become chronic kidney disease. The severity of renal disease is evaluated based on glomerular filtration rate, GFR, an indicator of how well the blood is filtered by the kidneys. GFR is calculated as a function of serum creatinine, a waste product that accumulates in blood plasma when renal function declines. The calculation takes into account the patient's age, gender, and race. Symptoms develop slowly over time, progressing from renal insufficiency to end-stage renal failure. Often, initial loss of renal tissue does not produce any symptoms because the remaining healthy tissue becomes more active and can temporarily compensate for the loss, a phenomenon known as renal adaptation. Symptoms appear when a significant portion of kidney function is already lost. The ability to concentrate urine is usually the first to be impaired, resulting in frequent trips to the bathroom, especially at night. Other early signs include fatigue, loss of appetite, and decreased mental ability. Because the kidneys remove metabolic wastes, control blood pH and fluid electrolyte balance, as well as produce several hormones, loss of kidney function may result in a number of complications. Accumulation of toxic nitrogenous waste can cause a range of symptoms, from nausea, vomiting, to confusion and seizures. Reduced excretion of hydrogen ions leads to increased blood acidity, or metabolic acidosis. Reduced excretion of potassium results in potassium overload in the blood, or hyperkalemia, which may cause cardiac arrhythmias. Hyperkalemia usually occurs only in advanced stage, but excessive potassium intake or use of drugs that prevent potassium excretion may precipitate the condition in earlier stages. Decreased excretion of phosphate results in hyperphosphatemia. Reduced renal production of calcitriol, an active form of vitamin D, contributes to low blood calcium level, or hypocalcemia. Low blood calcium stimulates production of parathyroid hormone, PTH, by the parathyroid gland. PTH promotes calcium release from bones in an attempt to raise blood calcium. This sequence eventually leads to an overactive parathyroid gland, or secondary hyperparathyroidism, which can develop before hypocalcemia occurs. As the bones continuously lose calcium to the blood, they become thin and weakened, a condition known as renal osteodystrophy. Symptoms include bone and joint pain and increased risks of fractures. Reduced renal secretion of erythropoietin, a stimulating factor for red blood cell formation, can lead to anemia. Diagnosis is based on renal function tests, which include blood and urine analysis. Ultrasound is performed to detect renal obstruction. It may also help in distinguishing chronic kidney disease from acute kidney injury based on kidney size. Treatments aim to control the underlying condition, address the complications, and involve certain nutrition supplements and restrictions. End-stage kidney disease requires dialysis or kidney transplantation.
It is applied in Ecuador, and C-reactive protein induced tests in clinical practice to evaluate diagnosis and predict inflammation. It is a marker of inflammation. Increased concentration of C-reactive protein predict total mortality and cardiovascular mortality in patients with chronic kidney disease.
Glasses of water, one after the other. Behind the sudden urge that follows are two bean-shaped organs that work as fine-tuned internal sensors. They balance the amount of fluid in your body, detect waste in your blood, and know when to release the vitamins, minerals, and hormones you need to stay alive. Say hello to your kidneys. The main role of these organs is to dispose of waste products and to turn them into urine. The body's 8 liters of blood pass through the kidneys between 20 and 25 times each day, meaning that together, these organs filter about 180 liters every 24 hours. The ingredients in your blood are constantly changing as you ingest food and drink, which explains why the kidneys need to be on permanent duty. Blood enters each kidney through arteries that branch and branch until they form tiny vessels that entwine with special internal modules called nephrons. In each kidney, 1 million of these nephrons form a powerful array of filters and sensors that carefully sift through the blood. This is where we see just how refined and accurate this internal sensing system is. To filter the blood, each nephron uses 2 powerful pieces of equipment, a blob-like structure called a glomerulus, and a long stringy straw-like tubule. The glomerulus works like a sieve, allowing only certain ingredients, such as vitamins and minerals, to pass into the tubule. Then, this vessel's job is to detect whether any of those ingredients are needed in the body. If so, they're reabsorbed in amounts that the body needs so they can circulate in the blood again. But the blood doesn't only carry useful ingredients. It contains waste products too, and the nephrons have to figure out what to do with them. The tubules sense compounds the body doesn't need, like urea, left over from the breakdown of proteins, and redirects them as urine, out of the kidneys and through two long sewers called ureters. These tubes empty their contents into the bladder to be discharged, ridding your body of that waste once and for all. There's water in that urine too. If the kidney detects too much of it in your blood, for instance, when you've chugged several glasses at once, it sends the extra liquid to the bladder to be removed. On the other hand, low water levels in the blood prompt the kidney to release some back into the bloodstream, meaning that less water makes it into the urine. This is why urine appears yellower when you're less hydrated. By controlling water, your kidneys stabilize the body's fluid levels. But this fine balancing act isn't the kidney's only skill. These organs have the power to activate vitamin D to secrete a hormone called renin that raises blood pressure, and another hormone called erythropoietin, which increases red blood cell production. Without the kidneys, our bodily fluids would spiral out of control. Every time we ate, our blood would receive another load of unsifted ingredients. Soon, the buildup of waste would overload our systems and we'd expire. So each kidney not only keeps things running smoothly, it also keeps us alive. Lucky, then, that we have two of these magical beans.
In conclusion, is patients with chronic kidney disease, their plasma concentration of natriuretic peptides are increased. In patients with chronic kidney disease, increased levels of osteoproteins are associated with the degree of kidney disease and effects attributed to its poor elimination. Thank you.